weekend. The tradition returns, as we just mentioned, the Family First Radiothon, May 7th and 8th. And in to talk about that with us is the CEO of the Five Hills Health Region, Cheryl Craig. Cheryl, good morning.
Good morning.
How are you today?
I'm great. Wonderful to be here, and thanks for this opportunity, Craig.
Anticipation continues to grow. We were discussing this, that our ninth one, some of the lead up has changed over the years. We're not quite as anxious as maybe we have been in past years because you get the routine down and how things go, but at the same time it's so exciting, and the one thing pushing us to maybe a little more excitement is, again, our big goal this year of $750,000. It's pretty substantial, isn't it?
It is a very substantial goal, and I think again what is so exciting, Craig, is that year over year with the Radiothon, not only have we achieved our goal, we've surpassed it. And what that speaks a lot about our communities, our whole entire region, the people that are just so generous during this time, and the level of commitment that folks have. And I can't go without saying the great work that you and Rob and 800 CHAB, your level of commitment. We were talking earlier, the 9 years have just incredibly gone by so fast. And here we are today. And lots of reasons for us to be excited, and lots of hard work that's certainly gone on behind the scenes. And the Radiothon, although there is more and more that becomes normal, the planning each year behind the scenes is still incredible for Kelly and all of the folks within the foundation and all of the volunteers.
Yeah, it's a tremendous group, and you mentioned the generosity of people. Dave Reedy, the Capital Campaign Chair, mentioned it at the healthcare celebration last week, and as he was talking to a fellow from Texas that he knows who was astounded and said this must be the most generous place in the entire world given the amount of money we raise. I mean, not only for the Health Foundation, but so many other charities in the region. It's a tremendous place and a neat honor for us, right?
It absolutely is. And I think the other thing for me that it speaks to is just the level of relationship and the importance of those relationships and the positivity that it really generates for our whole community. We know that the health of our community is very much dependent not only in relationships but on the caring and the commitment that we see each and every day.
Last year we hit a new high, $688,000, and this year we're going even higher than that. As you mentioned, $750,000. We want to equip the 72 inpatient rooms at our new hospital, which we're going to be in just a few months. Can you speak to those rooms, because you've seen them in action in other hospitals, right?
Yes, I have, Craig, and you know, the importance of private rooms for our patients, for their families, and as well for our staff is incredible. When we think of how we work today and the movement of our patients, many times unnecessarily, the work that requires of our staff and what it means to patients and families is really not the way that we want it to be. This opportunity to have these private rooms, and to your point, I have seen very similar layouts in other facilities. I've talked with the staff that work in those hospitals and the difference that it's made to them. When you know that the supplies are where you need them and that they're delivered externally by folks, so no interruptions. The staff know where their work area is, the families know where their space is, and there is space for them. And again, every room equipped with a bathroom for the most part. There's a few that in Emerge certainly don't have their own bathrooms, but it is just an incredible opportunity for us to design this state-of-the-art hospital and to be looking forward to moving in a very short period of time.
And we did touch it, I know, last year during the Radiothon, because we were also raising money for the capital campaign and equipment for the new hospital, and just the layout, and you alluded to it with these inpatient rooms and going from one place to the other. You're recovering from day surgery. You're not laying in kind of a semi-public area with a number of other people who might be in there for different reasons. You'll have your own place, right?
Right, and again, I was able to visit a site that has almost identical services within what we call call our universal care unit to what we will have. And again, to talk to staff and to see the patient flow, to see that patients, yes, they will come back from surgery and know where it is that they will be recovering and how they will go home. Their families will know where they are. And the flow is it's not just about the flow, but it is important for families and for patients to know not only will they have the privacy that they need when they need it, but they can really, again, anticipate what that experience and journey will be like.
We're with Cheryl Craig, CEO of the Five Hills Health Region. We're 1 week away from 800 CHB's Family First Radiothon, our 9th annual. 36 hours in the Town and Country Mall starting next Thursday morning at 6 o'clock, and the goal is $750,000. And Cheryl, on the website, we do have listed on our Family First Radiothon page all that equipment we're trying to buy. We mentioned the rooms, but those rooms need equipment, everything from hydraulic patient lifts to vital signs monitors to the family sleeper chairs. And if you ever slept on those sleeper chairs that are currently at the Moose Jaw Union Hospital, they could stand to be a little more comfortable. Right?
Absolutely. And again, the privilege and the opportunity that we have is there have been so many technology advances, including those sleeper chairs that you've talked about. And yes, many of us have slept in them. We know how uncomfortable they can be, but we also know how important it is for families to be with their loved ones at a time when they're hurting or they're scared or there's things happening that really require and need families to be present. So the monitors, the patient lifts, all of that is to advance patient safety as well as the safety of our employees. So again, we look forward to being part of the Radiothon and again to seeing the generosity of the people throughout our entire region.
Well, it's an exciting time, and this will be our last Radiothon as we speak about being in the Moose Jaw Union Hospital. This time next year, we'll be in our brand new hospital, and still on target for, October-ish, right?
Yes, we are being informed every day. I think it's really important, Craig, as much as, we've talked a lot about the private rooms, the infrastructure for the IT is one of the first of its kind in any Canadian hospital. So really, we are wanting to ensure that this is done absolutely perfectly. I have every confidence in Rod Cochran and his IT team. We also will have the support of eHealth from within the province, as well as other folks from other health regions that really want to be part of seeing what this technology will mean. So that's really the piece that is we want to ensure is done correctly. We have lots of work behind the scenes before the actual opening date. We will see staff and our physicians working, learning about the new way of working prior to opening. We want the move to go as smooth and as safe as it possibly can. And for those that have been watching, Montreal a lot bigger than we are, but there's lots of detailed planning that needs to go on to ensure, again, that safe, smooth transition for our patients and for our staff. And our volunteers will, again, be a big part of ensuring that success. So I'd mentioned to you earlier that the teamwork that is necessary and that I see every day for this state-of-the-art hospital is incredible. And it extends to our foundation for you and Rob as part of our team, as well as all of our staff, our physicians, and our volunteers. So it's really exciting times for me. I can't state that enough. And again, are there nervous folks out there? Are there some that are saying, "Is this really going to happen?" Yes, it is. And again, we just need to surround ourselves with positivity and know that we can do this.
Well, it's not every day that you get to be part of a brand new hospital opening, so an exciting time for you and healthcare in Moose Jaw and for all of us in general, right?
Absolutely. This is, again, a very, very important journey for all of us, for the city of Moose Jaw, again, a strong partner with us, and again, they're busy on the site right now as we speak. So again, the partnerships, the relationships, and the people that we have the privilege of working with each and every day, I just can't say enough about how important that is and how appreciative I am of the team.
I'll give a little bit.